Hi, I'm Dr. Chris Bryant with Kentucky Foot Professionals. Podiatrists treat a wide array of conditions, from bunions, hammer toes, heel pain, plantar fasciitis, Achilles tendonitis, but we also focus on a lot of skin problems. Today, I'd like to let you know about one of the most common conditions we treat at Kentucky Foot Professionals, or any podiatrist you're going to see, is called an ingrown toenail. So in a moment, I'm going to have one of my assistants come in, and I'm just going to talk to you about what to expect if you have an ingrown toenail when you come into my office, how you will be treated, respected, and taken care of. Now I'm back with Megan. She's just been recently hired to work in my office. She's a licensed cosmetologist in the state of Kentucky. With that, it also allows her to assist me and other patients or other clients in nail care. So today also, again, as I had mentioned, that dermatology is a very large portion of our practice, ingrown toenails in particular. So today I want to show you what I do if you were to come into my office. I'm going to wheel on over here. I love this chair, it makes my life so much easier. But every single person who comes in with an ingrown toenail has an autoclaved, sterile set of instruments that we use. We take pride in that. That's incredibly important. Also, patients are many times nervous when they come in with an ingrown toenail. They may need to have an anesthetic applied to numb the toe. I use a couple things to help. We use a topical gel, which can be applied right to the toe itself, as well as I employ a cold spray. The cold spray is really nice. It just takes some of the sting away from the initial stick of the anesthetic. People don't like looking at that, so I'm going to put it away so you don't have to look at it either any longer. But I'm going to just show you in general, after I numb the toe, we would take a small tourniquet, apply it to the toe and around, secure it with a clamp, and then use different instruments to free up the side of the nail from a little freer or spatula. It's a dull instrument, to specialized nail splitters. I can advance it with a small instrument. It's called a blade. Removing the piece that was ingrown or infected, in some cases, with another hemostat, just clamps it and remove the tissue. And I can file it down if there's any rough edges, and I make sure it's a nice little rasp. It's like a little nail file. So we can always ensure that we've removed all of the aggravating piece of the nail, get all that out of here. Then we always rinse at the end with alcohol or saline or betadine, just to make sure that's nice and clean in the groove. We then remove the tourniquet, and with a non-adherent dressing, so it doesn't stick, that's what that means, we put a little antibiotic ointment on that pad. It's like the inside of a Band-Aid. Put a little antibiotic ointment on there. Put a non-stick pad. I'm not going to do every single detail of it, but I am going to show you where I take some gauze, secure that to the toe, and then the outer dressing is Coban. Coban is a self-adhering but non-adhesive dressing that wraps around the toe. It secures around very nicely, and then we just cut it. Make sure the patient is comfortable. We give them a instruction sheet and a little pack of gauze, antibiotic ointment, and some Band-Aids so they understand how to take care of it. Again, there are lots of different things to do, and there are many methods for ingrown toenails. This is probably the #1 treatment for an ingrown toenail. I didn't get a graphic with it because you can see that all you want to on other sites. I just want to make sure that you understand that I'm going to do my best to take care of you with sterile instrumentation and positive outlook. Thank you very much. This is Dr. Chris Bryant at Kentucky Foot Professionals.